Hi everyone. Today let us talk about Aditus ad antrum. So this was a question that was asked in April 2003. So in this, let us talk about Mastoid antrum. What is Mastoid antrum? Macewen's triangle. What is Macewen's triangle? And finally, what is Aditus to the Mastoid antrum, also called Aditus ad antrum. And we'll see what is the clinical significance of this. Okay. Now coming to mastoid antrum. What is mastoid antrum? Mastoid antrum, it is something around which the entire life of an otologist revolves actually. Reaching the antrum safely and delineating it properly is the first step that you do when you start a cortical mastoidectomy, and that forms the basis for doing any further procedures. Let it be a modified radical mastoidectomy or a posterior tympanotomy, or you want to do facial nerve decompression, whatever you want to do. So this is the first step. Reaching this first step safely is where many of them really struggle also. But once you get the hang of it, reaching the mastoid antrum becomes a child's play, to say in other words. But reaching the mastoid antrum is always a challenging thing. In some cases, it can be really challenging. Okay, so this is the mastoid antrum. That's why mastoid antrum is given a lot of significance in ENT and basically in otology. So mastoid antrum, it is the largest air cell in the mastoid air cell system. So this is your mastoid. Okay, this is your external auditory canal. Okay, so this is external auditory canal. So this entire mastoid is like a honeycomb kind of cells. Honeycomb kind of cells is present. All of this is filled up with air cells. Just in the upper part of it, there is one large air cell. Okay, so this is called the mastoid antrum, the largest air cell of the mastoid antrum, which is present in the upper part of the mastoid is called the mastoid air cell system. What is the roof? The roof of the mastoid antrum. So whatever is forming the roof of the attic or the roof of the middle ear, the same thin bone continues posteriorly to form the roof of the mastoid antrum. So the same tegmen tympani, which forms the roof of the tympani, means middle ear, forms the roof of the mastoid antrum, where it is the same bone but it is given another name called the tegmen antri. Tegmen antri. Okay, tegmen antri. Okay, fine. Lateral wall. Now what is this? Why is this so much important? Lateral wall of the mastoid antrum. Lateral wall is basically the mastoid that you can see on the surface. Okay, so let me draw. Suppose this is the external auditory canal, and behind you have this thick bone that is present. That is the mastoid. This, if you look at the lateral surface of the mastoid, this lateral surface of the mastoid, from here to reach the mastoid antrum interiorly, that is, I'm telling medially, going inside, you have to drill 1.5 centimeters of bone in order to reach the mastoid antrum. So this mastoid antrum, to reach this mastoid antrum, there is a landmark on the lateral surface of the mastoid. That is called the Macewen's triangle. So if you go in this area, if you start drilling in this area carefully, you will end up reaching the mastoid antrum. Once the mastoid antrum is reached, from there you can drill further. That once you reach the mastoid antrum, you know what major landmarks, all the major landmarks of ear surgery you will reach once the mastoid antrum is reached, and by increasing the dimensions of the mastoid antrum, you can finally reach all the various landmarks and you can complete your surgery. Okay, now coming to what is Macewen's triangle. Macewen's triangle is also called the suprameatal triangle. Why is it called a suprameatal triangle? Because it is present just above the external auditory canal, external auditory meatus. It is present above it, so it is called suprameatal triangle. What are the boundaries of suprameatal triangle? Suprameatal triangle superior boundary is the temporal line, also called the supramastoid crest. So there is this temporalis muscle is there, right, which is present on your temple, on the side of your head. So it starts coming down and it gets attached to a crest of bone. That is called the temporal line, also called supramastoid crest. Except in maybe females and in some people, it may not be properly delineated, but in almost all the people, this supramastoid crest, you can feel there is a ridge of bone with your fingers. When you slide your hand from below upwards or from anterior to posterior, you will be feeling this supramastoid crest. That is the attachment of the temporalis muscle, and that also delineates where approximately your tegmen tympani is there where approximately where you have the change from the middle ear into the brain. So that forms a boundary. So it gives you an approximate idea where you are. Okay, so segment if you get the supramastoid test, approximately, yeah, this is the level where the brain is there. That's what you will get an approximate idea. It may be a little bit down or a little bit up, but mostly this is the place where the brain is there. Okay. Inferior, once you drill, I mean anteriorly, what you have the posterior superior segment of the external auditory canal. So external auditory canal, suppose this is the right side, this is the superior part, this is the inferior part, this is the anterior part, this is the posterior part. This posterior superior ridge, the posterior superior segment forms the anterior boundary of this Macewen's triangle. Here you will have the spine of Henle, and there will be small like depression and a small like a perforation there in front of the spine of Henle. This will also give you an idea that you will have where is your spine of, where is your mastoid, where is your mastoid antrum, and where you have to drill, and where is the Macewen's triangle. That's the spine of Henle also gives you some idea. So superiorly you are forming the line is nothing but the temporal line where the temporalis muscle attaches. Anteriorly it is the line that forms the posterior superior segment of the external auditory canal, and the third line is a tangent, which is like here, okay, which is going on the posterior wall, tangent connecting these two lines. This one that you have is the suprameatal triangle, also called the Macewen's triangle. Okay, so I covered anteriorly, I covered posterior inferior boundary by a tangent. What is the applied anatomy? These things, once you make an incision and you elevate the periosteum, you will get this. You can see the external auditory canal, obviously, and then you can see the spine of Henle. Then you can see the mastoid crest, and then you draw a line there and saying that, okay, this is where I want to drill, and from there you start drilling. So here he has shown very well in this diagram. So this is where is the Macewen's triangle, this part. Once you reach once you start drilling in the Macewen's triangle, slowly you start drilling and you reach the mastoid antrum. From there, once you have reached the mastoid antrum, you extend your triangle anteriorly, superiorly, posteriorly, inferiorly, to finally delineate what the dural plate, the sinus plate, the external auditory canal, the posterior external auditory canal, and the floor of the cortical mastoidectomy, and the tip. So this one is basically the Macewen's triangle. From there you extend your dissection or extend your drilling to delineate the dural plate, the sinus plate, the posterior canal wall, the tip, and finally once you reach the bulge of the lateral semicircular canal, you have reached the floor. Now you can see the Aditus here, where that is forming the communication between the middle ear and the antrum. Okay. Now coming to finally what is our topic here, Aditus and antrum. Aditus and antrum is nothing but an opening between the attic and the antrum. So as we said, this is the tegmen tympani, which is forming the roof of the middle ear. This is continuing posteriorly to form the tegmen antri. Okay, tegmen antri. So this is forming the roof. So this is the middle ear. This whole thing is a middle ear. The upper part of the middle ear is called the attic, also called epitympanum. That is communicating with the mastoid antrum through this gap that is present in between these two. That gap is that opening or that small pathway that is communicating this attic from the antrum is called the Aditus ad antrum. Okay. Now once you are doing the cortical mastoidectomy, now here we will see, now the cortical mastoidectomy has been performed in this patient. So this is the external auditory canal of the patient, this is the external auditory canal of the patient, and now you have completed this pink thing that you see, you have already reached the dural plate. You put this blue thing that you see here, you have already reached the sinus plate. This is the tip of the mastoid, and anteriorly, yeah, external auditory canal. A little bit of bulge you can see in the deep part of your cortical mastoidectomy anteriorly, that is the bulge of the facial canal. Then you will have the bulge of the lateral semicircular canal, and as you start drilling in front anteriorly, you will see the short process of the incus in the fossa incudus. Okay, this black one that I have denoted here is the Aditus. This is what is communicating this antrum. This is the antrum here. It is communicating with the attic above the superior border of the tympanic of the eardrum or the tympanic membrane. You have what is called the attic, right? So it is communicating this antrum with the attic. I hope I am clear. So here this is the attic. Now we are looking at the lateral cross section. Here we are looking from above. This is the operating kind of view. This is how a surgeon views a patient when he is operating. This is the external artery canal. Above it is attic, you know that. And here you will have the dural plate. You have now delineated the dural plate. The dural plate is in this line, now going to be in this line only. Okay, and this is the antrum. Now posterior superior part of the external artery canal, there was a spine of Henle. You drilled here, you reached the antrum, you did a little bit of dissection in front, and there you have found in the medially, the bulge of the lateral semicircular canal. This is what I am telling about, bulge of the lateral semicircular canal. Laterally you have the fossa incudus, and below is a facial nerve. Now this is a much more better way of depicting the same thing. This is the same surgery that we have drawn, but we have tilted the patient anteriorly. If you can imagine, you are tilting the patient anteriorly, tilting the table also anteriorly, so that now what you can see, this is the external artery canal. Now if you look from behind, it appears like this. This is a plate of bone that is separating this mastoid cavity from the external artery canal. External artery canal is front here. Okay, this is the plate of bone that is dividing it. Under you can see the bulge of the facial nerve. Okay, this is the tip. Okay, and as you have tilted posterior, now you cannot see the sinus plate. This is sinus plate, and here just above the superior border of the external artery canal, superior part of this bone, you will see the opening of the aditus. Aditus is like an opening. Okay, so here in the superiorly you will have the short process of the incus, which is in the fossa incudus. Inferiorly you will have the bulge of the lateral semicircular canal. This is medially, sorry, this is laterally above in the sense, in this case, from the patient's point of view, this is laterally, this is medially. For you, this is inferiorly, and this is superiorly for a surgeon. Here the horizontal segment of the facial nerve, which was coming from the tympanic segment, is turning and becoming more inferiorly actually. So here it forms the like it is present inferior to the aditus. Below the aditus is present the this is what I'm talking about. So second genu is very close to the aditus. So if you are not careful, you cannot drill in this area. You can drill here, you can drill here. You have to be very careful, because you are going to hit the important structures. The bulge of the lateral semicircular canal, fossa incudus in the roof, and just below the aditus you will have the facial nerve. So the aditus, you have defined the aditus, but you have to define it more like superiorly from the patient's point of view. Okay, I think I have made it clear in this diagrams. Now coming to what is the clinical significance of this aditus. When a surgeon does a cortical mastoidectomy, what we do is this is the cortical mastoidectomy. This is the external artery canal. We put normal saline in the external artery canal, and we put a suction here in the aditus and see if the water is getting sucked out. If the water is getting sucked out easily, or just by putting the water sometimes comes out into the cortical mastoidectomies. If it comes out, then that means that this aditus, the communication between the middle ear, attic, and this mastoid antrum and the cortical mastoidectomy is patent. If it is not patent, it means there is some granulation tissue, or maybe some polypoidal mucosa, or maybe sometimes cholesteatoma in this attic. And unless you remove all this the granulations or the polypoidal mucosa that is there carefully, without causing any damage, because there you have the short process of the incus. In front of it you will have the head of the malleus. So without causing any damage to this, if you can remove this and create aditus patency, means you put water in the external artery canal, it comes freely into the cortical mastoidectomy, then it means that the aditus patency has been achieved. Once the aditus patency has been achieved, it means that you have cleared the disease. Okay, you have cleared the disease, and after you do a tympanoplasty, the graft take-up will also be good. The success of the surgery is going to increase if the aditus patency is reached. If the aditus patency is not reached, you may also sometimes have to drill in the posterior superior part of the tympanic annulus. We talked about the tympanic annulus. Okay, but this is all like postgraduate stuff. Basically, aditus patency, the clinical significance is you have to get aditus patency by removing granulations or polypoidal mucosa in the aditus, which is present around the ossicles, without damaging the ossicles. If you can remove them, then your job is done. Thank you. Thank you so much for the patient listening. With this, we come to the end of Aditus ad antrum. We talked about Macewen antrum, Macewen's triangle, importance, clinical significance of Macewen's triangle, what are the boundaries of Macewen's triangle, what is Aditus ad antrum, and what is the clinical significance of Aditus ad antrum. Thank you.